Hello, this is Dr. Kevin Connors. Welcome to Module 1 of our Stop Fighting Cancer course, where we're going to go over some major pieces that you want to address as a cancer patient or somebody who's trying not to become a cancer patient so that you can best take care of your body in the most natural approach, whether you still have to do some standards of care or not, or you've exhausted that avenue. We have patients that come to us for all sorts of reasons. Many don't want to go the standards of care approach, and we understand that. Some have to because their cancer is growing quickly and they want to add integratively a natural approach, and we understand that. And some have not even thought about a natural/alternative approach, and they went straight down the standards of care aisle, which is the most common thing to do. It's a very scary thing getting a cancer diagnosis. And many people, especially if they're not regularly naturally minded in the first place, don't even have an open mind to natural things until a standards of care approach ends up failing. And they are told that there's not a whole lot that they can do except maybe palliative chemo or something like that. And that doesn't interest them, and they're starting to look at natural things. Well, we want to be careful to use natural things wisely as well. In this module, I'm calling the natural band-aid approach because we can use natural things like a band-aid too. Still not really addressing the cause, still not really addressing the reason why the person is in the state that they're in. We're just going to use a bunch of natural things, kind of the same way as you'd use medication. And a lot of functional, quote-unquote, functional medicine doctors or quote-unquote naturopaths or quote-unquote natural modalities really do that. They're maybe using nutraceuticals, maybe using herbs, maybe using vitamins or homeopathy, but still not digging in underneath to dig into the cause. They're still using it kind of like you'd use medicine. I have a headache, I'm going to take some Tylenol. Well, don't take Tylenol, take some white willow bark instead. Well, I guess it's better, than doing drugs that have all these negative side effects. But shouldn't you dig in to find out why you have the headache in the first place? Not that you wouldn't do those things, not that you wouldn't still use some curcumin or white willow bark or boswellia or something for your headache, but we're still using it as a band-aid. We don't want to make that mistake, and that's really what this module is about. So a natural band-aid approach can be the same as the medical band-aid approach. I guess there's nothing wrong with band-aids. You need to cover the wound. You need to deal with the symptoms at hand, but you need to find out why you did it. If you continue to put a band-aid on a wound because you're touching a hot stove, and you don't stop touching the hot stove, we're going to run out of band-aids pretty quick. Silly analogy, but we tend to do that in our medical system. That's really what the medical system is set up as. You don't go to the medical doctor until you have a problem, and then they go there and they have a solution to that problem. Well, currently, in the last 50 years, the only solution to that problem is here, take this drug, as if you have a deficiency in a drug. Well, natural care can lend towards that too, like I suggested. And we don't want to just do that without finding out why the problem is there and looking for a solution by fixing the why. So, one of our mottos in our clinic for years has been looking for the reason why. There's always a reason why. Well, sometimes the reason why is more difficult than other times to uncover. It's easy when you're touching a hot stove to know that, well, I'm touching the hot stove, that's why I'm burning myself, I guess I'll stop that. But when you have cancer or some serious disease like that, the reason why is a little bit more insidious to figure out. So we need to do some digging and some testing to do that. But a natural approach to a band-aid approach is really not a whole lot different than a medical approach. There's benefits to band-aids. There's sometimes you have to do surgery. When we're talking about cancer, debulking surgery sometimes can be extremely beneficial and can be necessary. Using chemotherapy can sometimes be beneficial and can sometimes be necessary. I know that's hard to hear that coming out of the mouth of an alternative practitioner, quote unquote. But let's be reasonable. There's times when chemotherapy, radiation, surgery is the right thing to do. And I think taking a dogmatic position either way is equally wrong. When I hear of an oncologist that poo-poos alternative care and the only thing you should do is standards of care, that's speaking out of just pure ignorance. But I also think when you hear an alternative doctor that says, I would never do standards of care, and chemotherapy just kills people, it's a poison, that's all it does. Well, true, it is a poison, but it can kill the cancer, and hopefully before it kills the patient. And it can debulk a cancer when the cancer is actively growing. Same thing with surgery. Debulking it can be the right thing to do. So don't let anybody tell you what's right or wrong for you. That's a personal decision that you have to make upon doing a lot of investigation and talking to a lot of different people. There's wisdom in a multitude of counselors. And I think it's best that you have counselors that aren't taking a dogmatic approach, that are looking at you like an individual and seeing what's the best thing for you to do. And then, of course, everybody's advice is going to be biased, but take each person's advice from different categories of healthcare, and then you can balance that out and hopefully bring it to the Lord and know what is the best approach for you. So there's benefits of Band-Aids. They're necessary. They can help heal wounds. They can protect us from further assault. And there's benefits to using that approach with cancer. But it can't be our only thing. If it is, we're doomed to just the results that standards of care are going to give us without digging any deeper. So we want to look at the drawbacks of cancer when we're only going to use a therapy for cancer without digging in to what are the causes, how to clean up the environment, how to fix the energy and the frequencies behind the scene, how to fix why the cells are acting that way, look at the genetics of the cells, not just here this gene causes cancer, because that usually doesn't exist, but the genetics of metabolism around it, so that we can deal with that in a more holistic way. The farther you can take a step back and look at your body and how to correct what's going on in your body and why it's happening, the better results you're going to have. It's not a perfect approach. There is not a perfect approach. And if any practitioner tells you that they can cure cancer in some way, I'd run away from them as fast as I could. But cancer is a complex disease. Matter of fact, each cancer is very different. Matter of fact, you could say every single person with cancer is a unique disease. So if you look at it that way and you look uniquely at your needs, you're going to get better results. So we don't want to just throw a bunch of supplements and nutraceuticals at a person to try to help them with cancer. That's just as wrong as throwing a bunch of drugs at a person to help them with cancer. And we certainly don't want to just get our information about different nutraceutical approaches off of, different media out there, because there's a lot of bad information out there. I see different posts on social media that says, well, if you take curcumin or whatever, it kills 98% of cancers in the test tube. Well, pretty much purified water is going to kill 98% of cancer cells in a test tube because they'll just die. It's not in a living environment. So be careful of false claims out there. Be careful of just bold-faced lies out there for the purpose of selling a bunch of supplements. It's misleading at best and unethical in my book, and just be careful of that. I have patients that come to us that are literally taking well over 100 to 200 supplements a day. I don't know how your liver can even deal with that. That's not even good for us. So take a step back and and get as specific as you can. Find a practitioner that will get specific for you and what your needs are, that will do different tests. That's what we're trying to promote. We don't want everybody to come to us, but we want everybody to look at their body differently and uniquely, so that they'll get the best results possible. You have to get to the root. You have to get to the cause. There are so many possible causes of cancer. What we're finding today is most causes of cancer are environmental. There are pesticides and chemicals in our environment that even if you're eating organic and doing all the right things, you're still going to be exposed to these things. These get inside the cell and cause the cell to replicate. And in the next coming modules, we'll dig deeper into that and how to deal with that. But you have to deal with those root things if you really want to change the environment enough to be able to heal the person. So just think about it. Typically, our medical profession, you could call it germ theory, but you could call it, this theory that there's something wrong with the body and something on the outside. If we inject it into the body, or if we do an infusion into the body, or if we give a drug to the body, then we'll fix it, without understanding that the terrain, the environment of that person, and even that emotional environment of that person is really what you really need to fix. Not that you shouldn't do an injection, or that you shouldn't use a supplement, or that you shouldn't use a drug. But if you don't clean up the terrain, if you don't clean up the environment, we're just not going to get as good of results. So even if you feel like God is leading you to do a standard of care approach, at least add on the natural things that can dig into cleaning up the environment, cleaning up your body, cleaning up why it's there in the first place, dealing with the emotional wounds that you've had in the past, so that you can clean up that fish tank and you're going to get the best results possible. And even if you do a medical approach, that drug is going to work better under a better environment. That's what our whole idea with these modules is, and we're going to dig deep into it, and give you some real usable advice on how to take those steps. So hold on with us as we go through this. I hope this is going to be a huge blessing to a lot of people. So I know not everybody can come to us. A lot of people don't even have a practitioner near them that they can deal with, nor can they even afford a practitioner. That's why we try to make this very reasonable, so you can take this information and go with it. So hold on through these modules, and we'll see you in Module 2.